Hello, hello, hello. I think we are officially live. I'm going live just a little bit earlier today. We had a last minute lunch meeting that came up. So hopefully we can have some people that join us live. I'll give people just a minute or two to hop on here. But happy Wednesday, happy Wellness Wednesday. And welcome, welcome, welcome. For those of you that know me, hello. For those of you that don't, I'm Dr. Becky from OsteoStrong here in Sioux Falls. I'm one of the owners. We've been in Sioux Falls area for a little over 3 years now. So Wellness Wednesdays, jumping on live to talk all things kind of bone health, physical wellness, overall strength, balance, posture, whatever you guys want to talk about. So the way this kind of works is if you're a member and have a question, there's actually a Facebook post that's pinned on our OsteoStrong Sioux Falls page. You can go ahead and leave your questions or a topic that you'd like me to discuss on that, or let your coach know, or write it down in center. And any live comments, if you're joining us live and you have something you want me to discuss, if there is time, go ahead and type those in the comments and I'll try to get to those as well. So make sure and say hi in the comments so that I know that you're here and know that you're watching. And if you're catching the replay, go ahead and type hashtag replay so we know you're here as well. So today we are going to be kind of addressing a really common question or confusion that we get here in the center. So one of the things that because we do focus on bone strength and bone density and emulating high impact types of forces here at OsteoStrong, one of a really common goal, or one of a challenge that a lot of our members deal with, is bone density issues, specifically osteopenia or a diagnosis of osteoporosis. So one of the things that one of their goals is to see an improvement in their T-scores or their DEXA scans. There's just a lot of confusion about that. So that's what today I'm going to primarily cover, and if there's some questions at the end, if there is time allotting, I will get to those. If not, we will make sure and get to those next week for sure. So essentially, when people have what's called a DEXA scan, or if there is a fracture and they end up, and unexplained fractures especially, and they end up getting a medical scan called a DEXA scan done, it is to check to see kind of bone density and where you're at in relation to normal. So essentially, every 2 years, you can get a DEXA scan to see if your bone density is maintaining, building, or if you are losing. So a couple of weeks ago, we had kind of talked about the natural life cycle of bone. We reach peak bone mass at about the age of 30. If we're healthy and active, we typically maintain that mass until about the age of 50, or menopause for women, and until about the age of 65 for men. And then the average person will start to lose about 1 to 3% bone density per year after the age of menopause. So typically, hopefully you're not diagnosed with osteoporosis after a fragility fracture or an unexplained fracture, but typically at the age of 65, one of the screening tests that's done when you go on to Medicare is what's called a DEXA scan, checking for your bone density. And that DEXA scan is essentially an X-ray that's used to measure the bone density of 2 areas of weight bearing in the body. And that is our spine, the lumbar spine, so our lower back, and then our hip joints. And the bone density that is measured out of that X-ray is converted into what's called a T-score. You're also given a Z-score, and I'll cover that in just a second and how we use a Z-score. But essentially, those numbers are converted into a T-score, and a T-score is then what is used to diagnose either normal bone density, osteopenia, or osteoporosis. So osteopenia is essentially low bone mass, but not low enough that it's diagnosable. Osteoporosis is the point at which you become diagnosable, and the point at which we really get concerned about fragility fractures in either the spine or one or both hips. So I have a little graph here. We're really high tech, but I have a little graph here that kind of explains. This is also posted in the comments but I'm going to explain what we mean when we say T-score. So essentially, this is just like a stoplight. Green means go, green means you're good to go. Yellow is your warning, and red is the diagnosis. So when you get a DEXA scan, or if you ever hear about people's T-scores, anything from -1 T-score and above or greater than that is normal bone density. And very roughly, an easy way to kind of think about a T-score is that number, whatever your T-score is, can be correlated to like a percentage bone loss. So if you have 0, if your T-score is 0, it's normal bone density, and there's been 0 bone loss. If you have a -1 bone or T-score, you can kind of roughly correlate that to about a 10% bone loss. If you have a -2 or 2.5 T-score, that's roughly 25% bone loss. So from -1 and higher or better, that's considered normal bone density. So up to about a 10% loss in bone density is considered normal. -1 to -2.5 is considered osteopenia. So you have low bone mass, but you're not technically considered into the osteoporosis range. It's essentially your warning sign. And if something isn't done, you will continue to lose bone mass and eventually end up in the osteoporosis range. That is roughly, those T-scores roughly correlate to about a 10 to 25% bone loss. And then a -2.5 or lower, -2.5 or worse T-score, or 25% or more bone loss is diagnosed as osteoporosis, and that's when we get into this red area. The big deal with osteoporosis is those bones become very weak and very brittle. They become significantly less dense, and so they be the risk of having a fracture in those bone sites, in those regions of the body, the weight-bearing joints, becomes a real concern. And compression fractures in the spine, or obviously breaking a hip, have massive impacts on your quality of life. And there's actually about a 50% mortality rate within the first year of breaking a hip. So that's roughly what those T-scores mean. So when you get a DEXA scan, you're going to get a T-score. And a T-score for you is your bone density converted into a -1, -1.5, -1.8, whatever. But it's your bone density compared to a healthy, average 30-year-old of the same sex. And the reason they use a T-score of a 30-year-old is because we reach peak bone mass. That's the best it's going to get at the age of 30. So your T-score is comparative to the age of 30 because we want to know how much bone loss there has been in the interim from 30 years old. There's also another number that's reported on DEXA scans, and that's called a Z-score. And a Z-score is your bone density compared to a person your same age of the same sex. And it's more just informative, just so you kind of know where you're at with the average person of your same age, but we don't use that Z-score to come up with a diagnosis, and we don't use that Z-score to kind of convert into a fracture risk. So I hope that kind of clears things up. What we're really looking for at OsteoStrong, if people are coming to us or doing our program and their goal is to either slow or stop bone loss, or slow or stop osteopenia or osteoporosis, and then certainly, reverse it, we like to have that baseline DEXA scan, just so that we know where they're starting. We know how kind of high risk they potentially are for injury, but then also within 2 years when you get another DEXA scan, that's how long it takes to rebuild bone tissue in any marked way that we would be able to see that on an objective test like a DEXA scan. So whether you are doing OsteoStrong, using medications, prescriptions, however you're approaching treating a bone disease, a low bone density disease, it's approximately 2 years minimum of that therapeutic intervention to see any kind of change. So you get a DEXA scan every 2 years. So here we really like our members to bring their DEXA scans in when they first start, and then of course when they have a repeat DEXA scan, so that we can kind of see how that intervention has been going, and then we can correlate that with their T-scores. So fun. We actually just had our 50th DEXA scan brought in yesterday, where there was an improvement with our members. So we celebrated that quite a bit. That's awesome. It's the whole reason we're here with our bone density members. So I hope that kind of clears things up. We get a lot of confusion with people who've had a DEXA scan. They don't know what it means. They don't know what a T-score is. The reports themselves are typically pretty kind of convoluted. They're really difficult to read. So just really what you need to know is a T-score is you compared to a normal, healthy 30-year-old, and anything above a 2.5 is a -1 to a -2.5. Warning sign, we need to be doing something. And that's osteopenia, low bone mass. And then, of course, anything 2.5 or lower is osteoporosis and seriously needs to have an intervention of some kind done. So I hope that's helpful. There were a couple of other pre-submitted questions. And this one is from Bob B. So, hi, Bob. But primarily centering around OsteoStrong and immunity. And because we're having an effect on osteogenesis or new bone growth, and of course bone marrow is where white and red blood cells are produced. Does OsteoStrong have any kind of impact or effect on immunity? And the answer to that is yes, and kind of a twofold way. So the first way is yes, the more bioactive your bone tissue is, the more your bone tissue is triggering regrowth. So in other words, the more active it is, osteogenesis, the more active your bone marrow is. So the more active your red cells and white cells are. We've actually had a couple members. This isn't something OsteoStrong claims at all. There's been no research done with it at all other than anecdotal, but we've had a couple of members whose red blood cell anemia has improved, iron deficiency anemia has improved. So yeah, and then also a couple of members with challenges with white count that have seen an increase in white count. So yes, the osteogenic loading, the stimulating the osteogenesis that we do here at OsteoStrong can conceivably have an impact on your overall blood cell count. But then the other part is obviously the more physically healthy you are, the stronger you are, and the more physically active you are, it just stands to go hand in hand with just being healthier in general. And so the more active that you remain, the healthier you're going to be and the stronger your immune system is going to be. So absolutely, we have an impact on immunity. So thank you, Bob, for that. And then there was another question submitted by Bob, specifically concerning kind of heart health or people who have challenges with AFib. And if our program is suitable for them, if there are any challenges, concerns, or if it's good for them. So just kind of wanting some clarification on that. And the answer to that is it is 100% safe for people who have heart conditions or AFib or any of those kinds of challenges. There's really only 4 main contraindications to our program. And those are an active hernia, muscular dystrophy, and people who are having uncontrolled blood pressure issues, just like any exercise program would be as far as exertion with blood pressure. So for people who have heart conditions or are dealing with conditions like AFib, the only time it would be unsafe or not recommended to do OsteoStrong or this program, just like any other exercise program, is if there is blood pressure issues that are not being addressed along with the heart condition or the AFib. A lot of times blood pressure, high blood pressure or high cholesterol go hand in hand with heart conditions. So that would be the only concern, is if you're not treating, if you have high blood pressure and you're choosing not to treat it along with the AFib. So again, just like with any other exercise program, as long as you're treating everything and you're a compliant patient, taking care of yourself, exercise-wise, anything and everything that you can do for heart health, you need to be doing. And OsteoStrong, or the osteogenic loading program in particular, is great for heart health, especially for people who are concerned with exertion or people who have shortness of breath that goes hand in hand with heart conditions, because there's virtually no exertion involved. Heart rate does not get elevated. We're not elevating our respiratory rate or anything of that nature, so it's very heart friendly. And like I said, aside from uncontrolled blood pressure, it's a perfect solution. So thank you very much, Bob, for submitting those questions. I don't see, Sarah, do we have any questions in the chat? I've been trying to not get distracted with that, so. All right, so none in the chat, so unless anybody has anything more that you want me to discuss, again, make sure you say in the comments, say hi so we know you're watching. If you're watching the replay later, please say hi. If you think of something that you want to address and just didn't get it during the live video here, a few things. There is a pinned post on our OsteoStrong Sioux Falls Facebook page, so please go ahead and put in the comments a topic or, hi Pat, how are you? Thanks for joining today. Go ahead and put that in the comments of our pinned post and we will address that the next time we go live, next Wellness Wednesday. Or if you are a member, you can please bring it up to your session coach. We have a clipboard at the front of the center as well for you to jot down some thoughts or a topic or a question. So if that's it, we'll see you next week.